Hello, everyone. It's another day with your fertility specialist. I'm your host for this show today, Ruth Ogogo. On behalf of Alps Hospitals, we love to say thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for always staying glued to your screen. Yes, it's Friday and we're doing infertility, secondary infertility. But before we get started, call up someone, share this link with someone. If you need to send data to someone, like I would always say, please do that right now so they are able to connect. As a lot of info for you to get, so much for you to grab, a lot for grabs today. So please make sure you're sharing this link with someone, as many people as you can. And to talk about secondary infertility with us today is Dr. Jane Ojani. Dr. Jane, it's good to have you.
Thank you. It's
So,
great to be here.
viewers, for the sake of someone watching for the first time, it will interest you to know that Dr. Jane is a consultant gynecologist. She's a minimal access surgeon, a fertility specialist. So, you know that you have the best personnel talking with you today. So, please drop your thoughts, your questions, your comments in the comment section, your opinions, whatever they are. Please feel free to drop them in the comment section and we'll definitely respond to them appropriately. Okay, so Dr. Jane, you're talking about secondary infertility. So it gets me wondering, is it infertility that went to secondary school now? Or well, that's just on the lighter note. But now when you hear secondary, it means there must be one that went to primary school. So now we will wonder which one is primary infertility and which one is secondary infertility before we eventually focus on secondary infertility.
Okay, thank you. So, none went to secondary school. Well, one just tells you that one is happening after the other.
Okay.
So, primary infertility basically is just when someone has not been able to achieve pregnancy or
Mm,
carry a pregnancy to term.
mhm.
So, you've never been pregnant. Yeah, so
Okay.
that's primary
Oh,
infertility.
oh wow.
Now, to the issue of the day, we have secondary infertility is
Yeah.
when someone is unable or inability to conceive, unable to conceive, or carry a pregnancy to term, haven't delivered or carried a pregnancy to term and delivered a baby. Yes,
Before.
so
Oh, okay.
that's secondary
Mm,
infertility. So, of course, you've had a baby and now you're struggling,
mm,
or for one reason or the other, conceiving again.
wow. This is serious. So somebody now, maybe you have had one shot now that shows I'm a fertile woman, and then next one now show yourself as fertile. It's not happening again. Well, okay, so as well, that's just on a lighter note. As funny as it might sound, it's not something really funny, and it's something that is really worrisome because I mean it calls a woman or a man to question if you've been able to birth a child, what's happening now. So I know a lot of questions might be in the minds of people. What really causes that? Because I mean, I've showed myself fruitful. I've given birth for the first time. So why am I struggling now? Are there possible things that actually cause this secondary infertility for people, or are there things that predispose people to it? Because it's just like, for instance, you might have, or another way to it, you might have a man that maybe has married before and then he has children with the first wife, and then maybe now the second wife is not struggling. Maybe they've told the wife that everything is fine with her. So now this man has birthed other children, and then now in a second marriage, what's happening? Why is she not getting pregnant? And we are saying everything is fine with the woman. So that's another secondary infertility for the man, apparently. So are there possible things that actually cause the secondary fertility or predispose people to secondary fertility?
Well, a whole lot can cause secondary infertility, and the causes of infertility or the primary infertility and secondary, they are not so much different.
Mm,
Yes, so basically for the women, commonly, I'll talk about the women and the men
okay.
separately.
Mm.
So for the women, commonly it has to do with advanced age.
Oh,
From the age 35 years for most women, and with increase in quest for knowledge and
yeah.
career, a lot of women start their birthing process. Maybe they've had a baby earlier and now
Mm,
try to focus on some career and all of that.
mm.
So after 35 years, there's so much reduction in the ovarian reserve, like
Oh.
in the quality of your eggs and also quantity. So of
Mm.
course that automatically puts you at a disadvantage, and now
Wow.
you
Wow.
start to struggle with pregnancy. Those That is a common thing for people advanced age. We'll have other conditions. Even for someone that's had a baby before, you could have polycystic ovaries syndrome, which are common issues that will affect fertility. You can have what we call thyroid problems. That those are just metabolic, some other conditions that can affect thyroid problems, and all they can worsen after. So
Mm.
you would have them. Yes, you're able to get pregnant the first
First
time. They
time.
could worsen after the first child, and that will
Wow.
make fertility become difficult. Even conditions such as endometriosis, which talks about having the lining of the womb in other places other than the womb.
Mm.
So it can worsen because it forms what we call scars
Wow.
and causes difficulties with free movement of the tubes and all.
Mm.
How about other conditions? From these women that have had deliveries too, they could develop scars from surgeries,
Mm.
having fibroid surgeries, removal of polyps, even the C-sections that women
Mm.
have can actually cause scars in their womb and make it
For them to
difficult for
conceive.
them to have babies.
Wow.
Then you now have sometimes following deliveries, you can have infections and or what we call endometritis,
Mm.
and those things can lead to blocked tubes and all. Of course, some persons could have a baby the first time, go ahead to get some infections like pelvic infections and
Wow.
all of that. So some of these things can actually lead to secondary infertility. So you see that with primary infertility, the causes are not exactly very far from each other, except those that
Yeah.
has to do with childbirth and all. While for the men, as age can affect the women, for the men too, as men get to 40, their the semen quality also drops.
Drops.
And of course,
Wow.
poor semen quality can affect your chances of spontaneous conception.
Conception.
Yes, and that can affect men greatly. Can also affect the volume, the count,
Mm.
which are even the movement. Those are the important characteristics of the sperm that can cause pregnancy. Then we talk about some kind of veins around the scrotum called varicocele. This can cause some abnormal increase in the temperature
Oh
around there, and
wow.
it can affect the sperm cells and all of that. So basically, for the men, sperm quality also drops, and of course, weight gain. You know, with advanced age, a lot of people are now independent. They're able to afford the kind of lifestyle they
Yeah.
craved for earlier. All this weight gain and again increased job stresses and all those things can affect hormone balance for both men and women, and all
Wow.
of this can cause infertility in one way or delayed conception
Mm.
after you've had a baby or been pregnant before, or you've been able to impregnate a woman earlier
Mm.
or before.
Sometimes I also think that people that suffer secondary infertility, I think that they wait too long. Because sometimes you hear someone say, "I have a child of 15 years," and then for that 15 years they've been trying to conceive. Maybe because they have the notion that since this one came spontaneously, it should be able to come. So, what do you think for couples that are probably suffering secondary infertility? How long do they have to try before seeking help? Because the fact that it happened now, maybe they feel like I don't want to give birth now to maybe 3 years time, and then yeah, eventually it's 3 years, and then now you're trying to conceive and it's not happening, and then you just keep wallowing in that hope of it's going to happen, and time is seems to be just flipping over. So how long do you think they should keep trying before they actually seek for help and get advanced treatment if necessary?
Well, so it still boils down to the definition of infertility.
Mm.
So, when you are unable to achieve pregnancy in 12 complete months, having had adequate unprotected intercourse for
Yeah.
that period, for women less than 35, for women over 35, within 6 months, the couple should seek care. You know, when you talk about 15 years, depends on when the person had the child. If at
Mm.
the time, okay, I want to stop at this point, but if the couple have a child and decide to wait for 5 years, then after 5 years they start to struggle or have some delays. We have
Mm.
the 1 year and it's hitting the second year. At that point in time, the earlier you seek care, I
Better.
mean, solutions will be
Could
proffered at that
prefer
time, and that would make life, maybe the struggle journey, shorter.
shorter,
Yeah.
exactly. That's just I just thought to ask that because I feel a lot of people that struggle with secondary infertility. they find it difficult to come to terms with the fact that they are not even having fertility issues. Sometimes they just feel another thing. I maybe now we'll talk about some of the myth that people feel, some of the wrong myth that people have about secondary infertility. I know I maybe I should talk a bit. Some people, when it comes to family planning, and or maybe you tell us a bit about that. But I think that couples that are struggling with secondary infertility should actually seek help on time, like you have mentioned. So viewers, this is just a wake up call to as many that are suffering from secondary infertility. You shouldn't stay for so long when you eventually have to seek help. The earlier you seek help, the better. Maybe there might just be some form of remedy if you seek help early. Of course, help if you seek for help early, we believe that the whole process should take a lesser time than if you actually stay longer. Well, that's just by the way. So maybe now we'll talk about some of the wrong notion that people have about secondary infertility that you feel is wrong with your experience over time. What are some of these things that you've heard from some of your clients when you tell them, okay, maybe now they've come to seek help, and then you're seeing some issues, and then they're binding and casting, it can't be my portion. What are some of those wrong myths or some of those wrong facts, wrong things or notion? Yes, let's say notion. We can't call them facts. Wrong notions.
Well, the myth surrounding secondary infertility basically borders around the fact that a lot of persons think that once you've had a pregnancy, it becomes very easy. You should be able to birth as many. Your fertility journey becomes very easy. It
I
should
see.
be an express ticket
Mm,
for the next pregnancy and the
yeah.
next one. And that is what causes a lot of these delays. Then a few persons would talk about things being sent to them and some
Mm,
other things, but not necessarily. I think but people just delay because they feel, and people are stagnated on that thought. If I've done it before, I should be able to do it now. But again, that's why we're here. We're telling you that a lot of things can change even after one child. And basically, I think basically that's just the myth. It can happen again, or they'll tell you you have at least you have one and all of that. No, once you've had a child, for every pregnancy journey and all of that, things could go wrong at different points in time, and for the same reasons, you never say never. So the fact they're able to get pregnant, it happened. Yes,
mm,
it's 100%. Aside that 100%, or you probably you had a 10% chance of pregnancy, and in that 10% you got it.
yeah.
So the next pregnancy now you fall in the 90% of it not happening. So you just
Yeah.
keep hovering around there. Well, basically that's the common myth. I've not really heard so much around contraception and all
Well,
of that. I don't know.
I've heard. That's all. I was just going to talk a bit about. I've heard some people feel like when they do some family methods, it feels like you are chasing the child away.
Wow.
so, so when you're not ready, the children have gone far.
Oh, okay. Yeah. Okay.
So
Interesting.
well, I've actually heard that, and it makes some women become scared of even trying to do family planning because they feel like family planning now, maybe when I'm ready to now have children, or when I'm ready to start having another, or when I want to have another baby, I will start struggling with conception. Well, I think that's a myth that maybe you should debunk, because I know a lot of people have that wrong notion that yes, okay, now I've given birth to one, let me rest, let me do family planning, and then they're saying no, wait, oh, give birth to three first, oh, don't risk it, oh. Not those kind of talk.
Well, I think that is a serious myth because contraceptives basically what they do is to help prevent pregnancy when you are not ready, and also when the body is not ready for you to get to pregnancy with a healthy body to have a healthy baby. So if you contraceptives won't stop you from getting pregnant, and basically what it does, it just alters the hormones in a way that it prevents ovulation, most of them. Yes, we have other mechanical barriers like the IUDs and all of that. But it won't stop you from getting pregnant. And once you take off your IUDs, but what will happen when you have all these contraceptives? If you have the intrauterine device and you now get bad infections that are not treated,
Hmm.
like your
I
intrauterine device,
see.
like your loop, you can get infections and get PID, pelvic
Hmm.
infections, and
Wow.
that would affect your tubes. And now pregnancy becomes a
Not
challenge,
necessarily
not
the
necessarily the
IUD.
IUD.
Hmm. I
Then
see.
for some of these hormones, some of them some work commonly, one of the injectables can work beyond the 3 months it's supposed to work, so that return to fertility is delayed, but it will eventually return. And of
Mm.
course, it's the response of the body because it differs for individuals.
Individuals.
So I feel contraceptives are not, they don't affect fertility. But again, while on contraceptives, those common causes that we have listed
Mm.
that can cause secondary infertility can catch up with anybody. Like you have a contraceptive plan that takes you 5 years. Then by the time after 5 years, you're 37, 38.
Yeah.
So you already you've gotten to what we call advanced maternal age in gynecology, just
Mm.
for to classify women so that you can manage challenges early over 35. So you get to that point, so your air quality
And all
and
that.
numbers drop. So
Yes,
you see
it's
that not your contraception per se, but
exactly.
the age factor playing significant role at that
Wow.
point.
So, hope viewers, I know that you're learning so much because there's a lot of wrong information out there. A lot of people say a lot of things. You see a lot of things on social media. When I remove this, I struggled and struggled. My period did not return and all. And then body responds differently to things. So you cannot just assume that it's because of contraception you are now battling with infertility and all of that. It differs for individual. And thank God that Dr. Jane has clarified that. So we all have the wrong we debunk the wrong notion and we embrace what is true and what is right, because a lot of informations we see out there are actually very wrong. It's just people saying their different experiences and not necessarily saying the real thing of how exactly happened or what possibly might have predisposed them to that. Well, I think another thing that people deal with, sometimes after they've given birth to one, people that are suffering with primary infertility, when someone that has one child now is talking about, I've been trying to conceive and I'm not getting, and then you hear some people telling them that at least you have one to hold. Yeah, you even have one to hold and you're complaining. It now makes you feel like when you're battling with secondary infertility, you shouldn't even seek for help. You should just remain because you have one to hold. But I think everybody's need differs. If I want to have more children, it's my decision.
Very
You
true.
should People shouldn't infringe into what it is that you want to get, and they shouldn't discourage people, I think, from trying to have more children. You have one, you want to have two, you want to have boys, you want to have girls, and then some people say, you even have one to hold, and you are trying to get me that I'm even looking for, and then you make the person start to feel bad, sort of. Well, I think that's something I think people should also look into. Maybe you could say something about that. But another part I think I would want you to talk about is their weight gain. You know, a lot of women have this thing with weight after first childbirth or after once from pregnancy, and sometimes they are not able to deal with that weight gain. Does that in any way affect their fertility? Because some of them, and you might have some of them trying to say, okay, maybe the doctor has counseled them, try to lose some weight and all that. Where does that weight in any way impact on their fertility now when they are dealing with secondary infertility? Maybe they are still struggling to conceive.
Yes, as you said, the introduction, weight gain too can cause imbalances in your hormone. I
Oh,
remember that
okay.
if you've had a child,
Mm.
you don't age backwards anymore. So as you are
Mm.
aging, you are also at increased risk of some conditions:
Oh, I see.
hypertension,
Mm.
diabetes, worsening
Mm.
polycystic ovaries,
Wow.
and all those things are features of weight gain. And
Mm.
so they might play a role in your fertility journey, and even other factors too, as we mentioned, they can still play a role in your conception. And when your obesity is also, it also hinders activity, maybe reduced frequency of intercourse and all of that. So your hormonal imbalance is there at the top. Some other conditions could just coexist, and you now have to
Mm.
battle to manage that. So basically, women are advised, when you start to put on those weights and all,
Yeah.
probably try to lose some weight, as we encourage
Mm.
women, because as simple as 5% weight loss can improve ovulation and also
Wow.
chances of conception.
Wow. Wow. So that's a lot again. So please watch that weight even after your first child. Don't just feel like, yes, I've given birth. It's something that comes with giving birth, but you should watch it because you never know whether you'll be a victim of secondary infertility. Well, okay, so are there some things that you think couples should look out for? You know, people have, like you said, they feel once you've given birth to one, you have stamped it, fertility is sure, you can have it. And are there some things that people should look out for, or are there some things that they could do to actually prevent this secondary infertility? More like maybe lifestyle, or some things that they should look out for, or test, or anything that you feel they could actually do just to see how they could prevent, if they could prevent secondary infertility in any way.
Well, not necessarily anything to prevent secondary infertility, as most of the causes of infertility are not they are not things you can modify. You cannot modify your age. If you have polycystic ovaries, yes, not treatable but manageable.
Yeah.
Yes, thyroid condition, same thing. So your there are not so much you can do to prevent this, but you can have heightened suspicion of a likely problem and seek
Mm,
care earlier.
okay.
So you start to struggle to conceive after 1 year, 2 years. You don't have to wait that long because you've had a child. Why is this happening? It's
Mm,
easier and or safer and better to get the information that everything is fine. Okay, let's try this. Let's go this way. Let's correct this factor. But then, if you have some other conditions, some conditions could just develop after. Even
mm.
hyperprolactinemia alone,
Oh
breast
wow.
discharge, you might not have it before.
Before.
And you can't just assume that because you've had a child, you just sit with the problem. Your periods will be affected, your ovulation will be affected, conception becomes a problem. So
Challenge.
you see that when you have heightened suspension or your health seeking behavior is improved, so that this at the slightest change, when you notice anything not going as you want them,
Yeah.
best thing is to seek care. Even after childbirth, some persons or you have a miscarriage that gets complicated because sometimes you have a child, then another pregnancy is about to come, or you have an abortion or a miscarriage or an abortion because you
Yeah.
are not ready. You might get an infection at that point. That's not
Mm,
the time to assume you have to just take a amount of antibiotics, suppress this and suppress that, or assume it's okay. Yes,
mm,
sometimes these things don't show you immediately until you start to struggle. So,
mm.
first,
Wow.
improved health seeking behavior and heightened suspicion of problems would help you get to the healthcare health center or to the hospital on time, and probable evaluation and solutions proffered at that visit.
So now you have shot the men. I mean, you have shot the women on the leg. Let's shoot the men. What should men do?
All
Because
right.
you've said a lot about what women could possibly do. What could men do? Because now, yes, they feel like they've impregnated a woman, or they've gotten a woman pregnant once, and then they just start to live life. And sometimes you hear a woman say, "My husband drinks too much. He smokes too much," and then now they are now come. Now it's time to make me get pregnant again, and I'm struggling. Tell him to stop drinking. Not those okay.
Well, so basically, alcohol, cigarette smoking, they all have a way of affecting the sperm quality, movement,
Mm,
appearance. Those are important qualities for a sperm to be able to um, get a woman pregnant.
pregnant.
So all those things are things that you can control. Amount, if you take a lot of alcohol, then the testicles to exposure to heat,
Hmm.
the laptops on our thighs and all of that, those things can
Gadgets.
also affect your sperm quality. And if a man too is trying, it doesn't matter if you've had 6 children. Once it becomes a challenge, fertility evaluation is not for the women alone,
Alone.
it's for
Hmm.
both the man and the woman.
Hmm.
Sometimes the problem just lies somewhere very close, that
Hmm.
once it's sorted out, probably at those distended veins around the testicles, the varicocele, once they're taken out, sometimes there's significant improvement in the sperm
Improvement.
count
Hmm.
and all of that. So the men should be aware of that. And also, as the men age, there is this notion that the men can be fertile as long
All
as
through
they
their
live.
life. Hmm.
Yes, Yes, it's a possibility. Just like the same women can get pregnant at their 60s and all of that, but you still have those at 40, at their 40s struggling. Same thing for the men. Over 40, sperm quality reduces. So they have to know that you can also struggle, and so they are need to seek you need to seek help quite early for solutions to be proffered.
Oh wow. Wow. So viewers, I hope we are learning a lot. A lot. This is just so much information that you are getting at just at a go. And you can't afford to play with this information. You can't afford to just let this information pass you. A lot of people are out there struggling. Some people are dying in silence because they are afraid to seek help because they feel like I've had one, and then you just keep waiting and waiting forever. And we know that in their hearts of hearts they really want to have more children, but they just keep it to themselves, keep dying in silence, and then they keep doing their local things they want to do just to seek help, and they're not getting any results. Whereas they could actually just seek some form of medical attention, gynecological interventions, and they could just have children if they want to. Well, maybe as we wrap up, I know that people most of the time that start dealing with secondary infertility, maybe they've at some point paused that. Okay, I've given birth to this, I want to pursue my career. Like you said some people for career sake, some of them give birth and they just want to. Is there some other way to preserve fertility? Maybe somewhere they should also think out of the box, just in case. Is there a way they could consider cryopreservation in any way, just in case? They never know when they'll be ready, or they never know when they'll start dealing with infertility. Is there some other counsel that you would want to give them?
Yes, for people that, in fact, preservation of your gametes, or what we call cryopreservation, is something that is currently on the front burner. People are talking
Mm,
about it. The awareness is beginning to come up, and it's very important. If you listening and you are well below 30, 35, and probably, okay, I am having this goal I need to chase, and I'm not sure
yeah.
when it's going to happen. Why not? You can preserve your eggs. You can also, or freeze, as we put it, or even your sperm. You
Mm,
can do all of those. Yes, we do that a lot. Even some people that have to go for some form of treatment or the other, you can
yeah.
freeze your gametes just for later fertility use. And
Yes.
that takes off the stress from you, or considering the aging process and all of
Yeah.
that. Then when you do that, you leave the rest to the fertility
Oh
experts.
yeah. Well, yeah, that sounds really interesting, and you have better quality babies because I mean you are younger when you do all that, and then later when you now say you want to, you know that it's still your young age gametes that you are coming for, not the advanced age that we could now be talking about some congenital issues and all of that. Well, okay, so Dr. Jane, what's your final counsel as we wrap up today to couples in general dealing with secondary infertility or infertility as a whole, whether primary or secondary? What's your final counsel to them?
Well, my final counsel will be, secondary infertility is not an end to a journey, and you have a whole lot that can cause secondary infertility, as the conditions or the factors that are responsible for secondary infertility are many. The treatment options are a lot,
Hmm.
and for every situation, on every of the condition we pick along the line for your evaluation, there's something to be done. The fact that you've had a baby before doesn't mean you can't have a blocked tube. Why not have a tubal patency test? If your tubes are blocked, other solutions for those that are blocked tubes will be preferred.
Hmm.
If you have worsening conditions, PCOS, thyroid conditions, those can be managed with medications, so that people don't stay and assume we have to wait because I've had a child. No.
Hmm.
One baby, you've had a pregnancy, and now you are sick, you are looking for another pregnancy. Even from the cesarean sections, the scars there can be removed during with a procedure called hysteroscopy, and that ends the wait, that ends the
Yeah.
delays.
Hmm.
So you see that um you don't have to wait, just seek care, and you should be evaluated as a couple, and solutions will be preferred.
Wow, thank you so much, Dr. Jane. I know you had a very wonderful time with our very gorgeous Dr. Jane. Yeah, it's obvious. I'm stating the obvious. Like, okay, so viewers, thank you once again for staying tuned. Thank you for having us and for engaging us in this live session today. It was good to have you all. And Dr. Jane, we had a good time with you. So we look forward to seeing more of you viewers in our next session. But until then, have a lovely time. Bye.